Assalamu alaikum. Our seminar today I talk about mandibular fracture. بالبداية حنحكي introduction. Fracture of the mandible occurs more frequently than that of any other facial skeleton. It is the one of the serious facial bone injury that average practicing dental surgeon may expect to encounter. It is also a facial fracture which he may have the misfortune to cause as complication of tooth extraction. Broadly, it divided into fracture with non-gross communication of the bone and without significant loss of hard and soft tissue. B. Fracture with gross communication of the bone and with extensive loss of both hard and soft tissue. مثل ما نشوف هاي الصورة. Internal anatomy of mandibular fracture تتضمن lingula, pterygoid, fovea, mylohyoid line, fossa, submandibular, sublingual, digastric, mental spines, geniohyoid, and genioglossus muscles. هسه حنيجي classification of fracture. ممكن يكون simple include closed linear fracture of the condyle, coronoid, ramus, and edentulous body of the mandible. مثل ما نشوف هاي الصورة الأولى يكون simple أو compound fracture of the tooth bearing portion of the mandible into the mouth by the periodontal membrane and at the time through the overlying skin. Commuted, usually compound fracture characterized by fragmentation of bone. يكون يعني يتضمن fragmentation of bone pathologic result from already weakened mandible or by pathological condition. Complicated fracture associated with damage to the important vital structure or single يكون only one fracture line. يكون the same bone multiple يكون عندنا أكثر من lines fracture of the same bone. Green stick when only one cortex of the bone is broken with other cortex being bent. It is found يعني يكون هذا أكثر شيء متواجد بالchildren. هاي الصورة. هسه حنحكي على fracture of the mandible can also classified according to the anatomic size. ممكن يكون بالدنتين يعني هنا راح نشوف احنا بهاي الصورة مقسمين الفراكتشر يكون عدة أقسام أما دنتين الفيلر fracture or condylar or coronoid ramus angle والبادي symphysis and parasymphysis. هسه المانdibular fracture classified according to their tendency to displace as a result of the bulk of the attached muscles into. أما يكون vertical variable مثل ما نشوف هاي الصورة الأولى يكون fracture line runs from the outer buccal palate obliquely background and lingually medial movement. أو يكون vertical unvariable يكون fracture line runs from the interlingual palate ويكون obliquely background and buccally. أو يكون direction horizontally or variable and invariable. A variable a fracture line runs downward forward so upward displacement avoided. A horizontal unvariable fracture line runs downward and backward upward displacement and undirected. Directed and indirect fracture when the force is applied to the mandible the point of the application of the force is compressed causing direct fracture and the resultant vector travels along the bone and applies tensile force on the point intersected by this vector causing indirect fracture. Whenever the direct fracture is seen at the site of primary impact one must examine the corresponding indirect fracture site and rule out the indirect fracture. هنا نشوف عندنا نوعين يكون أما direct fracture أو indirect fracture. هسه حنحكي عن mandibular fracture clinical finding. ممكن تسوي لي mandibular pain, malocclusion of the teeth, separation of the teeth, inability or pre-auricular pain with biting and positive tongue blade test. هسه investigation treatment plan of mandibular fracture is very dependent on the radiographical diagnosis. أما يكون essential أو desirable radiograph. essential يكون extra oral radiographs أو intra oral radiograph. هسه حنحكي على essential extra oral radiograph يكون oblique يكون من right إلى left اتجاه مالتها. fracture of the body proximal to the canine region, fracture of the angle or ramus and condylar region. posterior anterior تكون هاي راح تبين displacement of fracture in the ramus or angle and body. rotated posterior anterior view يكون fracture between the symphysis and canine region. reverse down views هاي ideal for showing lateral or medial condylar displacement. هسه نجي على النوع الثاني هي essential intraoral radiograph. periapical radiograph association of the tooth line of fracture, exciting pathologic related to the tooth line of fracture or fracture of the tooth in the line of mandibular fracture. occlusal radiograph هي يكون association of the root of the tooth to the line of fracture. desirable of radiograph panoramic and standard linear tomography and CT scan. treatment of mandibular fracture. The aim of treatment is primary to restore function, namely to restore both of the occlusion and pain-free normal movement, both TMJ. عندنا principle of treatment هي reduction, fixation, embolization and rehabilitation. هسه نجي على أول واحد close هي تضمن عندنا contra indication of close reduction, unvariable fracture at the angle of the mandible, unvariable fracture at the symphysis or body of the mandible medically and medical compromised patient. هسه حنحكي هنا على method of embolization. عندنا عدة طرق. أولا مثل نشوف هاي الصورة الأولى bounded orthodontic bracket. by bonding a number of modified orthodontic brackets حنخلي عدة براكيتات على التوث يكون مالتها light wires و intermaxillary elastic bands. الطريقة الثانية هي interdental wiring. بهذه الطريقة applied only applicable when the patient has complete or almost complete a number of suitable shaped teeth. يكون 0.5 mm of stainless steel wire is usually used. or arch bars. They are tooth boring device and used in IMF dental patient. They are the most versatile from the IMF. وعندنا IMF screw. These screw are self-drilling and self-tipping. This screw head is elongated and contain holes of forward displacement. وعندنا كذلك cap siblings. They are fabricated by making an impression of the fractured jaw and preparation of the cast on which cap sibling. وعندنا مثل نشوف هاي الصورة denture or gaining type siblings is in dental space jaw fracture. Complete denture can be used as a sibling and if the patient is not denture well. external bone fixation. This method is seldom used nowadays. It is indicated in special conditions such as the infected fracture caused by gunshot injuries or pathologic fracture. كل البرد إلها with early uncompleted treatment in the healthy young adults تكون فترة achieved after 3 weeks. وهاي الطريقة تكون where the tooth is retained in the fracture line وعمر البيشنت 40 years وبيشنت who are smokers mobile fracture. هسه حنحكي على الطريقة الثانية هي الأوبن fracture أو الأوبن reduction. الأوبن بيها advantage و disadvantage. advantage يكون عندما يكون عندي early return to the normal jaw or avoidance of air problems, bone fragment or low rate of malunion أو lower infection rate و avoid of IMF. disadvantage عندما يكون عندي morbidity of surgical procedure, significant operation time, expensive hardware and secondary procedure for removal of hardware. وعندنا آخر شيء حنحكي عليه method of internal fixation. الأول طريقة هي interosseous تكون the direct skeletal fixation of 2 or more bone fragments with the aid of the wire ligature bolt through previously drilled holes. نفس هذا نشوف هاي أول صورة هي دي يحكي عليها. ثاني عندنا many place they are most common تكون كل شائع for form of internal fixation used in the management of the mandibular fracture. The third way here, three-dimensional titanium. They are based on the principle of the quadrant as the stable configuration for support. The blades are adapted to the bone and are secured with the monocortical self-cutting screw. الطريقة الرابعة non compression rigid blades. هاي الطريقة الرابعة مثل ما تشوفها هنا. These blades provide rigid or load bearing fixation. They are mainly used in the management of infection. Where compression blade here, this blade will provide rigid fixation. The principle of the compression plating is by transforming the downward force of screw insertion into the compressive force and leg screw. This way, in oblique fracture, compression or leg screw can be applied without plate. And the final way, the bioabsorbable plate and screw. These are made from materials that undergo degradation, so they don't have to be removed after fracture healing. They are mainly indicated in pediatric fracture. And thank you for attention.